Hey, Eric, I'd say we're ready to go ahead and start the live stream. I'll call the meeting to order here in just a minute. Well, good morning. I'd like to call the July 26th School Mental Health Advisory Council meeting to order. We are meeting via Zoom today. We have been most of the last probably year and a half. So I'd like to welcome everybody to our meeting who's here with us and those who are watching live via the streaming network. We are going to, I'm going to ask Kelly to do roll call. As we do that, we typically use chat. I seem to be having a little trouble with that. So normally we put a chat. If you have a question or a comment, you put one in there. Jane, I'm going to ask you to help me. And if you see something in chat that needs to be addressed and I haven't particularly addressed that, for some reason mine's not behaving itself. So
will do, Kathy.
Thank you, Jane. Okay, Kelly, if you want to go ahead and do the roll call, please.
Okay. Kathy Bush.
Here.
Jean Clifford.
I'm here.
Dr. Jane Groff.
Here.
Carla DeHetre.
Here.
Dina Novak. Diane Gerstadt.
Here.
Senator Dinah Sykes. Dr. John Heim. Dr. John McKinney.
Here.
Dr. Ken Huey.
Here.
Gary Hinault.
Here.
Holly Yeager. Jessica Griffin. Jose Cornejo.
Present.
Judy Rodham.
Here.
Julianne Walker.
Here.
Kathy Kao. Kathy Moser. Kelsey Torres.
Here.
Kimber Kazitz. Kimberly O'Connor.
Here.
Kristen Garner. Laura Hattrop.
Here.
Leah Hawley.
Here.
Laura Marshall. Mark Torkelson.
Yes, ma'am.
Misty Zarnowski.
Here.
Melody Martin. Monica Kurtz. Monica Murnan.
Here.
Pam Weigand. Rachel Sodden.
Here, it's Rochelle.
Rochelle, sorry. My apologies. Ronnie Lawrence. Representative Russ Jennings.
Russ did contact me and he won't be able to attend.
Thank you, Kathy. Ryan Vaughn. Shelby Bruckerhoff.
Here.
Shirley Scott.
Here.
And then our ex officio members from KSDE, Bert Moore.
Present.
John Calvert. Kayla Love. Kent Reed.
Here.
Carrie Haig.
Good morning, everyone.
Laura Jurgensen. Myron Melton.
Here.
Pat Bone.
Present.
Shanna Bigler.
Shanna is on her family vacation, but we have lots of items. She provided much information for us, so.
All right. And is there anyone I didn't call your name? Okay, roll is taken.
Okay, thank you very much. We will later in the meeting be looking at a membership update agenda item. And one of the things that we're going to do, some folks are going off, some folks are coming back on as far as the membership's concerned. So we'll discuss some of that during that time. I also know there's a couple of members who let us know that they'll be in and out of the meeting today. A number of you have already started back that are involved in the schools. You've already started back to your school year and are busy getting work kinds of things done. So we do appreciate everybody taking time, whether you're a school person or not. We appreciate you joining us today for this meeting. With that being said, I would ask for approval of the agenda. You can unmute and.
I would make that motion. Mark Torkelson.
Okay, thank you, Mark. We have a motion. Do we have a second?
Second by Diane.
Okay, Diane Gerstad was the second. Kelly, are you doing this by a vote count?
Yes, Kayla will put up a poll.
Okay, Kelly, you'll have to help me. I am having computer issues and I can't even get that to pull up on my screen. So how are we doing?
Okay, so we have 18 voting to approve, none to disapprove. And is there anybody that needs to vote verbally?
Other than me.
I probably do because I'm only on phone. This is Shirley Scott. I vote to approve.
Okay, thank you.
Okay, looks like the motion has passed for approval of the agenda. Now we have approval of the minutes. That was the April 29th meeting. So we've all slept a night or two since then, but you've received a copy of the minutes. So do we have a motion to approve for the minutes for April 29th? Just unmute, please, and say that. And if you did it in chat, I don't see it. Motion for approval of minutes.
This is Jean Clifford. I move we approve the minutes.
Thank you, Jean. Do we have a second?
I second. This is Gary Hinault.
Thank you, Gary. Okay, and Kelly, you'll put up a poll for us again.
And can we have a voice approval for those that cannot vote on the poll?
This is Shirley Scott. I vote to approve.
Yeah, me too. Kathy Bush.
Okay, so motion's passed.
Okay, thank you very much. Kelly, did we have anybody request public comments or any email comments?
We did not.
Okay, that being said, we'll move on to the agenda. We're going to talk about the Kansas Communities That Care survey, the data usage and some best practices information. And Bert, or not Bert, but Kent, I believe you're starting us off here.
Yes, good morning, everybody. Well, we've had so many conversations, and they've been very healthy conversations about the CTC. And of course, you drafted recommendations. What we thought would be interesting and appropriate would be to have a practitioner's perspective join us and provide us an insight as to how CTC is being utilized in districts. Today we have our friends and colleagues with us, Christina from MTSS and Danira and Rebecca from Seaman USD. Christina, are you going to start us off?
I am.
Thank you for being here.
Thank you for having me. I am going to see about sharing my screen here. Kelly on that. It's saying it's not going to allow me to share my screen.
Give me 1 second and I'll make you co-host, Christina.
All right. And good morning, everyone. While we're getting ready for that, I'm Christina Mann. I'm a clinical social worker and state trainer for the TASN Project Kansas MTSS. And I want to thank my KSDE colleagues for inviting me here. And I'm honored to be here along with my esteemed friends from Seaman School District to talk about how we use the Kansas Communities That Care data, or the KCTC. I'm going to see, can you see my screen here? Yes, I get a thumbs up. Wonderful. Okay, so my part of the presentation is to provide a brief history and research behind the KCTC climate types report that we started using in Kansas MTSS. We went from not using KCTC data to developing a systemic process for using that data, and an overview of our newly validated school climate types report, a few key best practice concepts from experts in the field about using this and other key data in your MTSS, and share examples of one small district's success with using this data. Then my colleagues from Seaman will share a sophisticated look at how they use this data, and we'll have some time for questions at the end. So I just wanted to start out by saying that I have a real firsthand respect and love for how valuable the KCTC can be for communities. Since I've been using it since about 1999 across my career to help bring in millions of dollars in grant funds for schools that I've worked with, and we've convened community partners around this data to monitor it in relationship to shared goals that we set. And being a bit of a self-admitted geek, I really love the depth of the KCTC because it really allows schools and communities to do some phenomenal work that they would not otherwise be able to accomplish without this depth of data. At the same time, I noticed since coming aboard Kansas MTSS that we and our districts were not using this information. In fact, in working with Seaman, as they installed and implemented their multi-tiered system of supports with us, I had the pleasure of kind of following up and helping them connect their KCTC depression module data to suicide prevention and mental health efforts to kind of integrate that into their MTSS system they had built. And instead of seeing this as just a side project, I approached my coordinator, Linda Wilkerson, about the need to really systemically use this data in MTSS. And I literally hand-colored the state map showing the percentage of students across the state who endorsed the depression indicator question. Those who had felt so sad or hopeless every day for 2 weeks or more in a row that they stopped doing some of their usual activities. And by the way, now you can just click a button on the new and improved KCTC website to get this map in a very professional looking way. But at the time, when I showed this visual to Linda, it was impactful. And her immediate response was music to my ears. She said, yes, let's go ahead and work on this. So borrowing from a neurobiology lens and what Stephen Porges has helped us understand through polyvagal theory, a much more updated concept of how the nervous system develops and instead of just the fight, flight, freeze response, there's this additional part of our nervous system that allows us to flourish. And it's that part that down-regulates the fight, flight, freeze response. So really use this as an umbrella in connecting the research on positive childhood experiences, or PCEs, and adverse child experiences, or ACEs, as well as the student engagement research in the self-determination theory literature. And all this gave a grounding to the creation of our climate types report, a succinct one-page, visually compelling and actionable report, user-friendly for our districts. And thanks to our Greenbush partners, they have helped us refine and validate the report. So we now have, what this means is that we now have, with just 28 items from what had been in the past more than 140 questions on the KCTC, a succinct and reliable, valid school climate report. And this can be used along with the other valuable reports that Greenbush provides and has been generating for Kansas schools. So this school climate model has 4 broad climate types. 2 represent risk. You can see here the depressed climate type and the anxious conflictual climate type. And 2 are protective in nature, the empowering engagement and empowering relationships. And this overall model was found to be highly reliable. So we can reliably integrate it into our Kansas MTSS process. Each climate type asks a brief range of key questions that are grouped together to form scales. The Greenbush study validated these scales and refined them, and it resulted in 2 scales for the protective climate of empowering engagement, which includes student voice and student agency, and 2 scales in the empowering relationships, teacher-student relationships and parent-student relationships. And then the risk climates are single scales. So depressed climate scale, anxious conflictual climate scale. We're working on a report to outline the significance of this new model of school climate and its correlation with achievement. And I hope to come back another time with our Greenbush partners to update you on that. But today, we'll just take a glance at the one-page report itself, and I'll kind of orient you to it before we kind of talk about how we use it via best practices in MTSS and what our districts are seeing. So you do have a copy of the climate types report in your email if you want to follow along, but I just want to orient you at this very broad level. So when we look at this without even being able to see what the items are specifically and get into the particulars, just think to yourself, what stands out right away? Just when you visually look at this. And most people notice right away the color coding. And schools in Kansas MTSS are used to this color system, you know, with green being a solid foundation, positive results, yellow and orange being some concern, and red being high concern. So it's very intuitive at a glance to take a look at.
Christina, excuse me, just for a second. Kelly,
Yes.
Can you zoom in on it just a little bit more? I think that would make it more readable.
There's also an actual sample of this in your email.
Christina will need to zoom in on it herself. Kayla has shared the screen
Okay,
with Christina, so it'll be up to Christina to zoom.
great.
Okay. We'll dive into it and get some closer looks at it as we move along here. So the color coding key, just to kind of orient you, is is what is visually compelling. And we color coded it so that red means strong concern. And in this case, that means it's worse than state average by 10 percentage points or more. Orange is a moderate level of concern, up to 9 percentage points worse than state average. Yellow is about state average, and green is a strength, meaning it's better than state average by 10 percentage points or more. The clear squares are also better than state average by up to 9 percentage points. So these percentages shown in these squares are the percent of students responding to the question as indicated here on the report. So for example, on this one, during the past 12 months, did you ever feel so sad or hopeless for almost every day, 2 weeks or more in a row, that you stopped doing usual activities? Yes. The percentage of high school students responding yes was 46.72. Percentage of middle school students responding yes is 33.65 for this fake school district. We're using fake data here. So each of these run down the report, and you can see right away where your hot spots and where your strength spots are in the report. Now the state averages are also listed in columns for high school and middle school, just for comparison. They're not color coded so that this doesn't get too visually cluttered, and you can home in right away on the things relevant to your district. The climate types run down the center of the report. So it's organized to flow from the depressed climate to the anxious conflictual climate scale, to the empowering engagement with its 2 scales, to empowering relationships with its 2 scales. And you can see that those scales are comprised of specific questions for each scale, which we can go into in a little bit. And then at the top of the report, there's KSD building report card data. So things like graduation rate, attendance rate, assessment information, ACT average, and then there's the KCT participation rates and demographics. So you can see right away, it's also color coded. You can see if that participation rate was high enough that you can really rely on this data, or if you need to interpret it with caution. And then of course the questions in each climate scale run down the left side, and recommendations for what to do if that climate type is a challenge for you, recommended MTSS practices. And this puts solutions together with potential challenges so that the data is clearly actionable. And then finally, just as an overview orientation, there is a column for the district percentages, along with a trend key that shows the direction of change from year to year, whether things got better or worse, or stayed relatively the same for a district. So here's more of a close-up. And we guide our districts to look at their hotspots and their strength spots. And here's an example of the hotspot that we saw in the student voice scale in empowering engagement, and the questions that are asked in that scale. You can also see here the empowering relationships is a strength spot for this sample middle school, and the kinds of questions that comprise that scale. So we guide our districts to find these, look at these, and really participate in some focused conversation about the facts that they're seeing, what their emotional or intuitive reaction to that is, and what the evidence would suggest is needed in terms of actions to take. And for that one, they have suggestions that they can start with on the report itself to get them thinking about potential solutions to make this really actionable. Like if your student voice is low, you might want to help them. You might want to implement instructional practices like choice making or opportunities to respond. You might want to really connect up your individual plans of study to personalize their learning more and really give them some voice around that. You might want to help get them involved in setting norms for the classroom or for a special project that they're doing. Ways to really engage that voice as a starting point in school's problem-solving process. So as a one concrete example, here is the parent-student relationship scale and the items that feed into it. And these items, I share my thoughts and feelings with my mom and with my dad. I could ask them for help if I had a personal problem. They ask me what I think before most family decisions affecting me are made. And they notice when I do a good job and tell me about it. These all are very directly related to the research on positive childhood experiences. And we all know that family engagement is a key factor to success and well-being in school. But we might wonder, well, what can schools do about this as part of the climate types and school climate report? And as a part of their family engagement strategy, they could just simply spread the good news about positive childhood experiences and the impact that they have on child development, on learning, on preventing depression later in life. And we can specifically help parents know what specific activities really help kids feel safe and connected. And so I got so excited about this when I found out that the questions created a highly reliable scale that I reached out immediately to my good friend Jane Groff, and she pulled together several partners to create this resource that could be shared with parents and that's housed on the KPERC website. So that's just an example of putting the data to action and integrating it into some of the structures that schools create as part of their MTSS. Okay, so now that we have a very succinct one-page user-friendly report that we can really systematize as part of our use in Kansas MTSS, here are just a few thoughts about best practices for using the data. According to experts in the field, like the Collaborative for Academic and Social Emotional Learning, or CASEL, and they've really recommended how we think about measuring social emotional growth. And we've been really mindful of their guidance and integrating it in the way we do business in Kansas MTSS. And we've begun to encourage schools to think in terms of using a dashboard of data in three broad categories shown here. Using school climate data, examples are the CTC or the Family Engagement Survey. And now the School Climate Types Report would be a validated tool for looking at school climate. Looking at actual social emotional skills and competencies using a strength-based assessment. And examples of that would be validated tools like CellWeb or Panorama or the DESA Mini in Aperture. And then universal risk screening data. That is so critical for rapidly responding to needs. And examples of tools validated for that would be the SABRS or the BASC-BES or the SRSS-IE. And the universal risk screening data is what we're most familiar with in MTSS due to that framework's roots in addressing behavior and the goal of rapidly responding to need. And of course, all of us here know how critical within the mental health realm, how critical it is to do the screening piece. That's a critical need. And Castle and other experts in the field really recommend using a tool that's specifically validated for that purpose. So we can't use climate data to screen. You wouldn't use skill assessments to go looking for deficits as your way of screening. You want a valid tool for risk screening. And my understanding is that we have that now. Kansas will be supporting that through the SABRS, which is validated for that function in FastBridge. And we want to be really careful to understand that the critical function of a screener is to find every student who may experience risk and respond rapidly with support. So we wouldn't want to compromise the integrity or function of that. So examples of questions for us to reflect on for each of these categories of data and how they relate could be things like for school climate, its purpose and function. We can be asking, are we seeing growth in our climate for our building as a result of the strategies and practices we decided to systematize based on our data? For social emotional skills assessment, we can ask, are we seeing growth in students' social emotional skills as a result of the curriculum and instruction that we're providing? And for risk screening data, we can ask, are we getting better at finding all students who may need support and getting better at responding to that? These are some of the best practices that we use in looking at the KCTC in conjunction with other very important data for the behavior and social emotional content area of Kansas MTSS. And we've systematized specifically the school climate data in the report that I just showed you as a growth measure, thinking about it formatively, summatively, and longitudinally. We help districts look at it formatively, even as they're just coming on with Kansas MTSS. So they can really make decisions about their priorities for what to tackle first in their training journey with us. And that climate types report is one piece of data they use to determine that. Once they're working with behavior and social emotional learning as the content in MTSS, we help them use this climate types data to formatively plan and prioritize those practices that are really going to strengthen their core, and some of the training and PD they may need to help accomplish that. The following year, then, they can look at it summatively to determine if they've seen improvement and growth in their climate as a result of what they put in place. And then by monitoring this climate types report results longitudinally, they can validate that, yes, that growth is continuing and they're working towards sustained and continuous improvement over time. Another way that we have systematized and that we can look at the data is to look at the relationships among the data. And so one example of this is if the district's CTC data on that climate types report is showing that 40% of students are at risk in a depressed climate, but our data down in the screening area is showing that we're only picking up about 8% of our students at risk on the screener, that should really cause us to pause. And we can examine our screening practices and improve screening implementation. So that's a way of triangulating the data and understanding how important these relationships can be to kind of guide implementation. So here's an example of one district who used our climate types report throughout its initial and refined versions and the effects from doing that. In this district, for the item on depression, percentage of kids endorsing that depression item, they were at about 34% back in 2018 when the state was at about 29%. So 5 percentage points worse than the state average even. But their item on having I've been bullied question was phenomenally high. So it was 47% when state average was 27%. And this really caused them to pause and think about what practices early in their process they could put in place. They decided to do a student focus group and gather more information about the bullying, about where it was happening, all of that kind of thing. And they committed to putting into place active supervision. So they were in the hallways, they were in these areas and using the instructional practice of active supervision, not only in the classroom, but in other areas where this was occurring. And then in subsequent years, they really worked on building relationships with their students with positive feedback and implementing their SEL curriculum. And we can see when we look at the bully indicator question during the school year, how often have you been bullied at school? Their strategies really paid off. So while they were so much higher than state average, that active supervision strategy really brought it down that next year, that and some clarity about their norms. And you can see they maintained that downward, which is a positive result for bullying. They maintained that and really continuously it was closing the gap between where they were at a district in the dark blue and what the state average in light blue is. So they had immediate results, and kids also noticed that added visibility, that availability of adults, because on the item that says there are lots of chances for students in my school to talk with a teacher one-on-one, which is in one of our scales, it went from below state average for that district to above. It took a pretty big jump there, more than 10 percentage points in 2019. And they maintained that upward trajectory and getting above state average on that one. So you can really start to see the connection happening between these areas. As they added on their efforts for really noticing and providing positive feedback in subsequent years and sharing that positive feedback with families, they were already over state average in these areas. But as they kind of monitored their depression indicator, and they saw that it wasn't moving quite in the direction they wanted. So and neither were these data points around positive recognition. So they really amplified that, and you can see that growth. So it ended up being a positive trajectory over time. And their depression indicator started going in the right direction. So lessening depression over time in the school district until it went below state average, while that depression indicator was kind of ramping up statewide over those years. So those are some example, that's an example concrete of one of our smaller districts. And we really work with them, engage them to use this data to set priorities, to strengthen those core practices, to set PD goals and priorities, to integrate this information into their family engagement plans, and to really connect it up with their KISA and strategic plan goals, review it along with their skill assessment and risk screening to make responsive adjustments throughout the year. And we've gone from not using that data at all to it really being a big part of what we look at in Kansas MTSS, very valuable. And we're very grateful to our Greenbush partners and Lisa Cheney and those folks for helping validate and really refine this model so that we can use it knowing that it is valid and reliable. So that was just broad brush strokes for you all to kind of paint the systems level view of how we use school climate data from the KCTC systematically and in a school-friendly way to set priorities, to show growth. And we do have some exciting preliminary information that's starting to show the relationship between and among the various climate types, which ones might leverage the greatest gains for us, and their connections to academic achievement. So hopefully we can update you with Greenbush partners in the future, but now Rebecca and Danira will walk us through the sophisticated work that they do as a mature and sustaining MTSS district and how they use their KCTC data. And then I think we'll have time for some questions at the end.
Thank you, Christina. That was very good information to see the growth and the usage of that data, and look forward to the next group. So it looks like we're going to have Rebecca and who else is coming on to present for us?
Danira.
Okay, very good. Well, welcome to both of you. And are you able to co-host now?
Let me try the share screen at this moment.
Very good. I see you, so I think you should be able to.
All right, let's see.
There you go.
While she's getting set up, I'll just introduce myself, Rebecca Kramer, Director of Early Childhood and Elementary Education for Siemens Schools USD 345.
I'm Danira Fernandez Flores, Director of Secondary Education. And we're here to share our novice steps in using the data that is provided to enhance programming at Siemens Schools. So let's see, we use our data at several levels, definitely a support for the MTSS process, but we also use it as we have community conversations and also program adjustments. And then Becky will also talk about our transparency with our public with regards to this data.
All right. As Christina said, we have been a TASN MTSS school district in the past. We did go through a 3-year joint effort to systematize and learn how to implement multi-tiered system of supports. We are in our 3rd year without as much TASN support, but we have definitely seen a lot of those components institutionalized, and we continue with a lot of things that we learned in that process. One of the things being a very strategic and very concerted effort to review all data points. If we feel like if we're administering assessments, we need to review the data and have conversations and do something with the data. So we do, particularly with KCTC data, we look at it at multiple levels and make sure that everybody's speaking the same language and that we all know what our data looks like. So we implement the self-correcting feedback loop whenever we're talking about school improvement, and we use data as the crux for that. So we look at the KCTC data from a holistic viewpoint, district level, at our district leadership team. Our district leadership team is comprised of teachers and principals from across the district, and it actually is the team that helps organize and do the work related to our accreditation process through KISA. We then allow, from that process, we have building representatives on the district leadership team that go back to their buildings then and help facilitate conversations around their building specific data for KCTC. And so they'll do the same types of protocols. They'll go through their own explicit data for their particular building on their building leadership teams. And then we also utilize that data in collaborative teams. At the elementary level, that looks like grade level teams. So we may look at it district-wide. All 6th grade teachers might look at that data together and make some inferences and some planning and program adjustments. We also look at it related to content areas. So just this summer, we had a group of elementary counselors that worked together. The first thing we did was look at our social emotional behavior data, and KCTC being one of those data points. And we use we celebrate our successes, and then we also look at the areas that maybe need a little bit more work. And we started to identify some areas for growth we're revising our comprehensive counseling, school-wide counseling program plan. And so those are just some of the ways in which the teams across the district look at it. And you can see that we're all talking about it in the same types of ways and across all levels. So we do implement the self-correcting feedback loop with our KCTC data.
Another really good example we have for you, as the state was looking at their Blue Ribbon Task Force for bullying, we had already received our KCTC data and looked at our bullying data. So we took it to the district mental health team. We analyzed the data. We also invited Kent in to talk about that Blue Ribbon Task Force. And then from that, we brought that data back into the buildings to start that collaboration on creating our bullying prevention handbook. So that's an example of how that self-correcting feedback loop would work with some of the layers of all the information we get through the KCTC.
I will say, just to piggyback off that, we are very pleased that we got our data this school year, as opposed to getting the data the next school year and then having to kind of backtrack. So very thankful that in the same calendar school year, we were able to get our data. We could kickstart the year with the most recent data. So we appreciate that and I'm very thankful.
And so that's exactly right. That springboard me into kind of how we use it program-wise and building-wise as well, and how useful that data was this past school year. So at Seaman, we have at the secondary level a group called PAC, Principals, Advocates, and Counselors, and that is the group that drives our individual plans of study goals. And this is the group that I bring the social emotionally learning report, because part of that social emotional, we've connected it to our career life planning curriculum, which involves not only the college readiness component, but also that social emotional is integrated to that. So we were able to bring the 2020-21 social emotional learning report to PAC at the building levels for both middle school and high school. And what you see on this slide is an example of a piece of the data that we got. And we take a look at our data, and then we analyze the data through a specific protocol. We look at the first level, we look for facts. What exactly is this data telling us? Then we allow ourselves to try to wonder and interpret what it might mean. Then we get it to the third stage, which is what does this imply? And finally, that action step. What are the next steps? What we really appreciated about this data was that we were receiving the information was paralleling the anecdotal evidence that we were looking at behaviors that were occurring in our middle school. And so our principals and counselors were able to say, oh my goodness, this is what we've been talking about. Now we've got this hard numbers that help us understand that what we're feeling is not out of bounds with what is going on as reported by our students. The other component that was very important with the early release of this data is that now our freshmen center is prepared for the incoming 8th graders. Our 8th graders are telling us how their world was running. And so this summer, Counselors would be able to go back and look at our social emotional curriculum and realign it to address some of the areas that we need to address for that incoming freshman class and so forth. So, and in this manner, we use it almost in a formative manner. We look at how our kids are doing, and then we're able to adjust curriculum in order to address some of the concerns that are being expressed through the data. And so that is at kind of a building level how we would look at the data, analyze the data, and act on the information we receive.
All right. You know, the data in this particular area is not something that just public school educators can address. And so we've kind of really shifted our mindset to be of a more community. How can we pull together? What do we need to do to address some of the things that maybe have higher ratings than what we anticipated, or maybe what our perception might be? You know, the valuable piece of this survey is that it is our students telling us anonymously how they're feeling and what their needs are. And there are some areas that we have to work on. And it is really useful data. And so we know that a lot of what we need to work on in regards to the topics associated with KCTC are going to have to be involving families, have to be involving our community, looking at our resources to be able to address some of the things that they are saying are areas of concern for them. So we want to first start by just being completely transparent, right? So we have an annual report. We have a district strategic plan that measures social emotional learning built in. It's one of our measurables. We report annually at a board meeting every year, our KCTC data around October, November. We also share it in an annual report that goes out to our community. It's at an annual banquet from our Seaman Education Foundation. And there's hundreds of people in the room. There are business owners, there are community members, there are alumni, there are staff, there are tons of people that come to this banquet. So very transparent. We also post it on our website. So you can see there that we have a discussion item that we discuss the topic every year with our Board of Education, so they are abreast of what our students are telling us and how we're using that data. And then we also share it very strategically at our building site council meetings. So as I spoke earlier of that self-correcting feedback loop, once building leadership teams have looked at their data and identified areas for improvement, they may take that data to their site council representatives and get some input from constituents from each building on how might we address this, get some other ideas, and what are some ways that we can work towards solving these issues. So there's a couple of the ways. Again, the annual report is posted on our website, so you can see multiple years and you can track how we've been performing. So
some of the information and the data that we gather can be items that we can address at the building level. But some require us to reach out to our community, not only to inform them of what we are receiving information about, but also to use them as resources to find a solution and come together as a community. We have yearly, or try to do yearly, except for COVID year, community conversations around elements that surface in the KCTC. So one of the elements that we were noticing at our high school and middle school, and Becky can also attest to at some level at the elementary, was that we were observing a lot of vaping or electronic cigarette issues coming up at the administrative level. That, with the data from our discipline report, as well as the anecdotal evidence, and then the KCTC data with regards to e-cigarette use, we could tell that we were looking at a problem that was not only in our district, but also county and state. And we were noticing that the problem seemed to be higher at our district than within the county and state. And so we sought to engage the community in this conversation. Vaping, vapes, e-cigarettes are relatively new in our society. And so we felt that our families were perhaps not as prepared to understand or know what was going on with our students. So what you see in this slide is our reaching out to our families and starting a task force to look at the data and together with our community, decide what were our next steps. So we brought the KCTC to them. We shared the e-cigarette and the cigarette data as well. And then together as a task force, we started reviewing what our policies were and looking at a toolkit checklist that was provided at the state level with regards to best practices. Once we've identified all that information, we started identifying next steps and solutions. And one of those next steps was to hold a community conversation in which we would provide resources from around our district, nurses, pulmonary experts, KBI, I believe, and then just others to help inform our community members what it was, what e-cigarettes are about, how they affect our bodies, and what they look like as well, and how students are describing how our kids might be getting their hands on this product, etc. Along, not only were we having on one side a conversation and informing our community and providing them resources that they might need, but we were also having a curricular conversation on the other side as well to provide our students with information they needed to know about what they were consuming as well. So we came together, and I haven't done a huge review of our data, but our cigarette use went from 13.5 at the end of the 2018-2019 year to 7.3 at 2019-2020. And then, as you know, that set of questions have changed, and now there's more of a vaping section. And for our district, we are now at 6%. So it looks like we are coming down. I hope the trend continues. But I'm also noticing that our 12th graders who were reporting in 2019, 22.9% of them using e-cigarettes. In the next year, it went to 19.4%. And in this last report, we've got our seniors down to 12.5%. So I think maybe something of all the work that we did is helping our students make better decisions. And I think that sums up kind of our novice steps in our attempt to use KCTC in benefit of our students and our programmings, as well as our community.
Well, thank you to the folks from Seaman. For those folks on our call who don't know where Seaman is, would you kind of describe where your district is and a little bit about your district?
Becky?
Sure. We are right in Shawnee County, right outside Topeka. We do have a couple schools in the Topeka city limits, and then the rest of our district. We're kind of a mix. We're a suburban district, I guess, but we do have our upper northern regions of our district do have some strong rural connections, but then we also have some very high poverty at-risk buildings in city limits. And so we have a nice, I guess you would say, a nice group of constituents. Each class is about 300 students, so we're a 5A school. A lot of our staff live in our community. We like to say we're a 5A bigger district, but we really have a small town feel to our district. Everybody goes to the football games and all that kind of thing. So yeah, right outside Topeka.
Okay, very good. Well, I thought some folks might not know where Seaman was. I knew where it was, but some folks might not. So really good information. Are there specific questions for the Seaman folks? Because they probably need to get off and they have school things to attend to. So if anybody has some specific questions, put them in the chat, and we'll bring those up for the folks from Seaman. Really appreciate you guys joining us today. I know you're probably both getting ready to get started in school and everything going. So we have some questions from anybody.
Kathy, this is Jean. I just had a comment. I just wanted to thank you all for this presentation. It was really, really interesting. And I very much appreciate the way that you've gathered this data and then laid it out in a usable format, because that's the difficult way, is to make it understandable and usable for other people. And I know it took a lot of thought and a lot of effort to do that, and I really appreciate it. So I think it's going to really benefit our students. Thank you.
And Jean Clifford is a state board member, represents Western Kansas, if you don't know who she is. Any other questions or comments for our folks from Seaman?
I have a quick question, Kathy.
Yes,
I
Bert.
wonder what % of their students participate in the KCTC since it is an opt-in survey.
We have been as high in the last 3 years as 78%. We've dipped down just a little bit this last year to about 74.9%. We've worked really hard to get as many of our students to take the survey as possible. So really, we do that opt-out option. We provide at enrollment in the enrollment process, and a really small percentage of all of our student body. I think less than 30 families opt out of the survey for all grades 6, 8, 10, and 12. Does that answer your question?
Yes, thank you. Because I just thought it was important for people to understand it's not 100%. And across most districts, it's not, because it is an opt-in now, where before it was opt-out, and then the legislators put a bill together that required opt-in for this survey. So I just wanted the council to understand what numbers we're talking about and percentage of students. Thank you.
We value this data tremendously, and we are working really hard to raise our participation rates. So we're very proud of 74.9% total at Seaman. We're above the state at 48.9% and above the Shawnee County from 62.9%. So because we're asking our families, our students to engage in this data, it behooves us to look at what they're telling us and act on the information.
Well, and you've had an interesting where you've not only been able to show the data, but the data is showing you, the CTC data is showing you what you're seeing with other data and what feedback you're getting from your students. So you've really kind of been able to validate all that. So any other questions for our folks from Seaman?
I guess I do have a question, Kathy. So when you guys have been able to utilize this across areas, if you will, so obviously not just focused on mental health, but wellness, the vaping, bullying, and being that, how has this helped you approach integrating your efforts around all of those things that we know need to be done instead of together? Has this data helped you do that?
So like vaping specifically, how do we integrate that across other areas maybe? Are you talking
like so how has this data helped you integrate your efforts within the district?
So on the task force that Danita spoke of earlier, particularly with vaping, and this is just the most recent example, but we've done some social media type things prior. We know we need to do some more around the areas of suicide and bullying moving forward. But in the area of vaping, when we had kind of consolidated and focused our energies on the vaping concept, our PE teachers were also on the task force, and we looked at ways to be able to integrate just informational things. We didn't even talk about the drug paneling thing, Danita. You can talk about that really quick on another way to integrate it. But our PE teachers started to build things into their curriculum for health and PE courses. Our parents obviously became more aware and were looking for signs. We had grandparents the night of that community conversation that were coming up saying, thank you for telling me what the signs are and what to look for. And we showed them all the multiple types of devices, grandparents raising grandkids and have no idea what those technological things look like. And we're very thankful that they now could at least be looking for some of those things. So those are all the ways that those community conversations and the way our teams look at the data to be able to then take it and what are we going to do about it, incorporate it into existing courses. We began looking for curriculum. Like Danita said, we reviewed our policies. We increased our signage for vaping. And just those little things that maybe all contribute to the same thing. Is that kind of what you were asking?
Mhm.
Yeah.
Okay.
We also had students on the task force. And so that engages that student body, not only in the analysis of our policies, but also being part of the solution as well. Because some of our students went back to some of their curricular areas. I'm thinking of the SVTV, Becky, which is our TV channel in which our students would then, what's that word? I don't know.
PSAs, public service announcements.
Yes. Then our students who were conducting public service announcements within our building. And some of those get pushed out to families as well. And talking about the effects as well as the data around vaping. And so that's pieces of how they integrate. Also, because we use all these corrective feedback loops, we might have members of, say, the mental health team who might also be part of another team. And so they're able to kind of bring together, over here we were talking about vaping, what's that effect with this other component that we're talking about now? That's another layer of what these corrective feedback loops can help us with, is that cross information and integrating all areas together and supporting what we're trying to promote or implement.
Who is on your school mental health team?
We have principals, teachers, we have community members, we have Board of Education members,
social workers, the behavior specialist, just a little sprinkling of every area.
Special education teachers.
Well, you gave us some really good examples of not only how you look at your data comprehensively, but then how you can respond. Like the vaping was an issue that blew up very quickly across the state and every place. And so you had some data and were able to respond very quickly. So thank you very much for what you did there. And of course, Jane would pop in on the chat, but the community engagement with families is key to get that communication going. So if there's not any more questions for our good new friends from Seaman, we really appreciate you taking your time
very much
today and sharing with us how you use this data, not only to look at the data, but make it actionable with responses. So really appreciate that. So thank you. Christina, I think I'll go back to you because there may be some specific questions for you. Bert, first of all, is there anybody else who's presenting today on this?
Not that I'm aware of. I think this is our panel for presentation.
Okay, well, Christina, I'm going to go back to you and see if there's any questions that the group has. I felt like that you made some really good points on how the CTC data has come along, and they've been able to really validate some of this data and make it more actionable. So is there any questions for Christina, either in the chat, or you can unmute and come on and ask your question of Christina? So that PowerPoint was very helpful for me. So I appreciate myself being able to see that and see what's available out there. So questions for anybody there?
Kathy, this is Jean Clifford again. I just had a question. I know we compare our data statewide, but do we have national comparisons?
We do not currently have access to any national comparisons with the KCTC.
Now, that may be something that Gary might be able to follow up on, as Kate Adds is the funder for KCTC. There are other states who utilize Hawkins and Castellano, which is the CTC model. But Gary, are you familiar with any neighboring states that utilize the same CTC method that we do? He must be on a call, but I can double check that, Gene, and try to find out. Now,
good question.
Yeah, it is. However, one clarification, and if you're looking for national comparison, then the Youth Risky Behavior Survey would be something, and that's a CDC, the Centers for Disease Control assessment, and Dr. Mark Thompson, who eventually will present to us in one fashion or another, he might be able to provide us some national comparison.
Yeah, I think that may be where we get that national piece is through that survey.
And the effort that this particular climate survey that was developed, this is a Kansas effort, right? It's not a
Yes.
national.
Correct.
It has
That is
evolved in
something that we did through Kansas MTSS and alignment, just wanting a very succinct, user-friendly school climate measure that would be valid to use as part of our routine database decision-making with schools. And then that can also highlight areas that they might want to dig into more deeply in the broader KCTC data. So yes, this was a Kansas piece, the climate types report.
So Christina, I have a question for you as far as your MTSS districts. Do all of your MTSS districts use the KCTC or just those that choose to?
This is a choice. The vast majority of our districts do use the KCTC. We had probably a few that hadn't been using it in the past that, because of our process, started using it as well. So, but a lot of our districts do use the KCTC.
Thank you.
Mm-hmm.
Further questions or comments for Christina?
Kathy, this is Myron. Just a couple of comments and maybe a question or two. First off, I think just the acknowledgement and a thank you to both Kansas MTSS and to Greenbush and KDADS for all the work on this. You know, when the bullying task force took place and we went out across the state, we heard a lot of feedback and concern about the data that we're getting collected and questions about the length of the survey and how the data was received when we got it back and just a variety of things. And the response to that was so positive and really took it to heart and made some really substantive changes in how they've done that. In our last meeting, Kelly shared some of that information as well. But I think that's just such a positive example of how these two organizations are working together. I had a couple, and one other comment. Listening to Christina's presentation, I'm really excited about this moving forward as you start looking at the social emotional growth piece on the social emotional learning side and how that can get leveraged into the academic work so that those two things aren't working in isolation, but we can see that back and forth leveraging of those two areas is really exciting. One question I had for Christina, so as we think about this moving forward, just kind of a logistical piece, how are systems accessing this information? Do they get it automatically when they pull up a CTC survey? They can get these things. Do they have to request these forms? Does it come through MTSS? I'm just curious how a system would go about obtaining the climate surveys.
Yes. At this time, how we work with it is that districts that work with Kansas MTSS, if they sign a data agreement for it, we automatically ask Greenbush to generate a climate types report for them. We are, like I said, in the process of doing a more comprehensive study around the relationships, the strength of the correlations among the climate types and the strength of the correlations of that to achievement with state assessment. Once that is really finalized, I'm hoping that there will be a process to make this more widely available to districts, but I don't know that that's been delineated quite yet.
that was going to be my question, Christina. And I think Matt kind of goes back to the department a little bit as, how do we get that information more readily available to other districts? Because to me, it's very powerful data, and especially as the social emotional growth area is a key goal area. And obviously we're now getting some data that shows it directly correlates to the academic, for years and years and years, we just spent all our time looking at a math test and a reading test. Now we're showing how that does correlate. So I hope the department's working on a plan to look at how that can be more accessible to our other districts.
Well, I think as part of that, the importance of when Christina introduced this, so she talked about how this produces actionable data. And so districts having a process in place to be able to respond to the data. And just like when she talked about screeners, that if you're going to use screeners, we need to be able to have the capacity in place to respond to the needs that a building may find in that, and having that system in place to do that within the building that is built through participating in and installing a healthy multi-tiered system of support.
Well, and as you well know, Carrie, I know I do, and everybody on here probably knows, there's lots of data out there, but unless you have a process in place, how to use that data, it can also be used against you. So you really do have to be very strategic about how you put together a plan to use that data. So I think MTSS has a good plan. We appreciate your work and how you're doing that and working with districts. And that data report, I'm really excited about. I think that's a wonderful report and can really help schools. Just a note, Leah Hawley did put in the chat box that PCE resource that was referenced earlier is now available in Spanish. So for the parents, that is available in Spanish also. So she and Jane both know that information. So anything else today for Christina?
I had one more question, and I wondered if there was any ability to compile it so it was regional. So you could maybe identify issues that were problematic in different regions of our state, even though they might not be in one specific district, but that whole area had certain concerns.
Currently, CTC is released at the state level, the county level, and the district level. And we would have to contact Lisa and the crew at Greenbush to see if we couldn't do it, like, for example, board districts. That would be interesting to see data, but they would have to do it separate from what they're currently doing, Jane.
Yeah, I was just wondering if, I'm in Western Kansas, which is smaller communities, but maybe urban areas have concerns with this and certain things that maybe we don't have in rural areas. And I also was asking about the national perspective, because I kind of think we're probably doing better than many other states. But it would be nice to confirm that, even though we're working really hard in Kansas to do these things. We ought to be proud of ourselves that a lot of things that we don't have, a lot of here. And that's through a lot of efforts and a lot of personal relationships that our teachers and our schools have with these students. So I think that would validate that.
Yeah, I think you're on the right track, Jane. Just to give you an example of the national perspective, a year and a half ago, I think it was, Wallet Hub did a survey, a research survey, and they've said that Kansas led the United States in the fewest number of fights in school buildings. And I presented that to the board. I think it was about a year and a half ago. So those are the kind of things that make us believe that, yes, we are doing a better job here than other places.
I just really like to see the positive information get out there, because I think we're all inundated with, things that are more negative. And I think we do a great job, and we can keep trying to do better, but I'd like to acknowledge that.
You know, and I think if you even looked at Siemens trend data, and that was trend data during COVID. So it makes it even a little that much more remarkable that they were able to decrease some of those things during the time when we were dealing, and we're still dealing with the pandemic. But I think that's kudos to folks for the hard work, and you know, MTSS, the districts. So we just got to keep it up. We got to reach everybody. I know that's what we're trying to do. So Christine, thank you very much. Kent, thank you for organizing and coordinating this and get some folks on. Very good presentation. We're running a few minutes ahead of time, but I think we'll go ahead and take our break. I show about 10:20, so let's come back at 10:35. We'll come back off break. So you might Well, good morning. I show about 10:36, so hopefully everybody's been able to have a little bit of a break and get back online, and we'll continue with our agenda here in just a minute. So we've got a number of items that are going to be a little, I guess I'd say, less lengthy than others. So we'll kind of move through quite a few items as we go through the next, looks like about 5 different pieces. So there's quite a few things to move through here. And then our last item will be the membership updates. I don't think that'll take us too long, but we'll spend a little bit of time on that as we want to go through and talk about the process of new members in various terms and stuff. So Myron, I believe you're on next. We're going to talk about the STAR recognition program and an update, and you'll provide us with some information on this.
Sure. Thanks, Kathy. Yes, this is Myron. I'll provide you guys with a brief update on the STAR recognition program. First off, just kind of a reminder, I know some of you on the council don't deal with this every day and maybe thinking, what is that again? I've heard of it. So just a little bit of a reminder about that. If you recall, I know we've talked about the state board outcomes, areas that the State Board of Education have identified that really drive all of our work. Everything that we do aligns towards those 5 state board outcomes. And the outcomes that they identified were social emotional growth, kindergarten readiness, individual plan of study, graduation rate, and post-secondary success. 2 of those areas, the graduation rate and the post-secondary success, really are quantitative measures. They're fairly easy for us to calculate. We collect the information from a district, we calculate that, and based on that, we can set goals for improvement, things of that sort. The other areas that the kindergarten readiness, the IPS, social emotional growth, and more qualitative in nature. So we measure those differently, and in order to do that, we've identified this process, a STAR recognition process, by which we can collect data and analyze data for the systems. The other area that we include in here that's measured a little differently, won't go into a lot of detail about that, is the area of civic engagement. So in essence, we really have a 6th area that also is included in the STAR recognition system. So as we look at this, we think about the purpose of STAR recognition. It's really kind of twofold. One is, as we set it up, we wanted to set up a really rigorous rubric to really recognize those systems that were doing exemplary work in each of these areas. So as we set the rubric up, it wasn't set up to so that everyone would be able to attain that. However, as you look at the rubrics we've identified, it brings us to our second purpose, and that is when we talk to systems about their let's use social emotional growth as an example. It gives them a framework. So the rubrics that we have really kind of give them a high bar, a framework, a rubric that they can work to achieve. So a number of systems will apply or did apply that did not receive any kind of recognition, but we've heard from them that it was really helpful just to have that exemplar model in place, so they know where their strengths are, where their weaknesses are, and how they can improve and move towards this recognition system. A couple of things before we get into the numbers that you need to know about. First off, when this first rolled out, it rolled out late in the spring, the first year that it came out, and we decided to go ahead and do it, even though it was fairly late in the year, because we wanted to give systems an opportunity to see it, to have an opportunity to apply. But because it rolled out late in the year, the second rendition of this, the second year to apply, they were very close together. They really didn't have opportunities to necessarily, put into practice some new things that would show improvement. But now we'll get back onto more of a regular cycle with that. So as you look at these, it does impact the number of applications that came in the second time around. And also it's important to note that systems who in that first year would be 1920, I think I got that right. Systems within that first year, if they received a recognition, and we're talking gold stars, silver, bronze, if they received a level of recognition, we carried that over into the next year, the 2021 school year, because we knew they wouldn't have an opportunity to really put new things in place and have time enough for it to show a positive effect. So as we look at numbers this time, we're looking at numbers that were received in the 2020 school year, and those have carried over again into to this year. Interestingly, we did have a number of systems who received recognition in that first year who did go ahead and apply again. They'd put things in place, they'd made some improvements based on the feedback they'd received, and felt like, they'd had opportunity, if nothing else, to measure themselves, but also possibly increase their standing with regards to their recognition. And we had several systems who had not received recognition before who reapplied, and some that were brand new. So for a relatively new process, we've been very happy with the way that it's rolled out. Well, Kelly, if we can go to the next slide. There we go. So look, we're going to talk just a little bit about the recognitions that were received in that first year, 2020. And again, keeping in mind that these awards will be carried over. So as we look at this, one of the things you're going to notice as we look at all three of these things, that of all three of the qualitative areas, there's only one system that received a gold star, which tells you a little bit about the rigor that's involved in the rubrics and the standard that we're setting that we want systems to move towards. So this is the kindergarten readiness area. You can see we have 3 there that received bronze, and we had another 6 that received copper, so a total of 9. I can't tell you the number of off the top of my head of systems that applied for this, but there was a significant number that did apply. You need to know that we have a minimum standard. So there are things that systems have to achieve, certain factors that if you haven't met those entry-level criteria, you don't even complete the application. We had a number of systems that just hadn't hit that entry-level criteria, and that's kind of what their goal is to focus on moving forward. But a total of 9 receiving recognitions for the area of kindergarten readiness. Kelly, next slide. As we look at individual plans of study, you'll notice that I said we had 1 that received gold in these areas, and that was Piper in the area of plan of study. And you can see here we have also a total of 9 systems that received recognition. You can see below which ones of those systems were recognized. And then we'll move on to social emotional growth. Social emotional growth had the, if I remember right, I think it had the most applications and had the most systems that were recognized, which is really exciting for us because this is the one that probably aligns most with the work we do as a mental health advisory council. And there are a lot of systems out there who are really doing nice work and putting good systems in place. You can see here we had 4 who received silver in this area, and a total of 19 systems overall that received recognition. One last thing I want to note about this application process, I think is really important. As I've made reference to a couple of different times, it is a very stringent process and rigorous process. Within all 3 of these areas, we have multiple reviewers, review teams for each of these areas. So I can speak for social emotional growth for every system who applied. Each of those had 3 independent reviewers that reviewed the applications. Those 3 came together. They looked at each other's ratings. If there was discrepancies, there was discussions that took place around those areas. So in addition to being a rigorous process, there is a rigorous review process as well to make sure that we really are getting multiple perspectives from different people as they look at that data and then determine on these qualitative sides which ones are going to receive that recognition. I believe that's the last slide on here. Kelly, could you advance to the next? Oh, just the number for this year. The numbers of this year are lower. We expected them to be. Again, just because of the timelines and how compressed they were. Kindergarten readiness, I can tell you we had a significantly higher number than 4 who applied, but once again, there's that entry level criteria that everyone has to meet, and a number of systems weren't able to meet that criteria. And we had, and these are, I'll tell you, these are estimated numbers. They were coming in, the deadline was Friday afternoon at 5. They were coming in late in that time. So just roughly we're looking at, I believe it was 12 for individual plan of study and 13 on social emotional growth. We will make changes to this program moving forward. We think we've gotten it off to a good start. One of the things that we are talking about as we move into the next year. This year we opened these up, in the spring. We're talking about next year opening these up earlier, so that early second semester we'll open the application. Not only does it give systems more time to do this, but we really think it's best practice if they are going back and reviewing these rubrics over time and updating those and reviewing those on an ongoing basis. So giving systems a little bit more time to be able to reflect on that and make the changes they need to make. So with that, I know we have, Kent, Carrie, but other people on here who've been involved with that process. Would you have anything else you'd like to add?
I think you did a great job, Myron.
Okay.
Thanks, Myron.
Sure.
We felt like it was important to give a little bit of an update of where we are with the STAR recognition. And as you can see, social emotional growth is one of those 3 areas, which is directly what we all deal with. So it's nice to see not only social emotional getting some good numbers, but all the other areas too. So,
Kathy, I wanted to, when you said that, I hate to drag this out, but I do think it's really important. As we present these in individual areas, and going back to the conversation with Christina Mann about integrating these things together, Carrie's comments about how do these work together. I think it's really important to note that while we present these this way, there's so much integration that's taking place. Kindergarten readiness, half of what they do is social emotional learning, and so much of that work ties to what we do. The fact that we're doing pre-K all the way to post-secondary, so we're really looking at the whole span of a student's time with us, as well as a couple years beyond. We won't go into this in depth, but Kent could talk for a long time about the work that's going on right now between social emotional learning and the work that's being done with IPS around workforce development, and those social emotional competencies that get embedded within there. So while we're presenting these kind of individually, it's important to note that the ties between all these areas are becoming much more evident, I think, to the field in general.
good. Yeah. Well, that's what we want.
So I would just add one piece, and unless Myron, you might have went over this and I just missed it, was for the social emotional growth rubric. We had to narrow it down, and so we chose to narrow down and focus on the area of measurement, largely because the board goal looks at and asks for districts to measure locally. And so that's the area that when you look at that rubric, you'll see it's focused on the measurement side of things and not as much process. And that sets it apart from the other 2 qualitative areas. But I feel really good about the information and the discussions doing that has generated And I think it's been really helped us move forward.
Great. Well, appreciate everybody's work on that. And, you know, it's just indicative. I mean, it wasn't too many years ago, we weren't talking about social emotional growth at all. So it's pretty indicative about the impact it's having, and what's a good thing we had it in place after these last few years and this upcoming year. A lot of kids will be going back to school that maybe weren't in the building too much this last year. So thank you, Myron, and the rest of the team for your work on this and bringing us up to speed on the STAR recognition program. Okay, the next agenda item is, I'm going to introduce it just a little bit. Catherine Smidling from the department is here and is going to share with us. Everybody remembers working on the bullying task force recommendations. The bullying task force worked diligently to come up with recommendations to present to the board. And then they, as an organization, suggested that there be an implementing entity, so to speak. And the board directed School Mental Health Advisory Council to be the group who worked on how these recommendations were going to be implemented. And we've worked extremely hard on that, as you all know. One area that we continue to work on, and I'll just reference here, I've got the task force document here, was under the training, professional development, and teacher preparation. It's recommendation number 7. And the particular one that Catherine's going to address today, and I'll just read it to the group so they know what this says, and so this will give us a little context for today. Pre-service teaching preparation must also address the issues of bullying in schools and various anti-bullying approaches. Institutions of higher education preparing teachers in Kansas should include training on bullying, youth prevention, youth suicide prevention, Jason Flatt Act, in their classroom management and other components of their programs. The State Department of Education should ask institutions of higher education to report on the bullying-related portions of the preparation curriculum and share best practices among institutions. Okay, so with that recommendation, we really kind of took a look at, okay, well, how are we doing with this? Catherine Smidling with the department works directly with the institutions of higher education. So she's going to talk with us a little bit today about this particular piece of the bullying recommendations and share with us the information she's got. So Catherine, welcome.
Thank you. Thank you so much for letting me come and speak with you all. So I am also in teacher licensure and accreditation, right over the wall from Myron. And I work with all of the teacher preparation programs in the state. We have 24 colleges and universities that offer 420 different preparation programs. And I work with them on the reviews of each program and the steps it goes through in order to be approved and reapproved. And then with each college and university for the review of the education unit and its accreditation. So I'll ask Kelly to forward to the next slide. We talk lots and lots about standards, and I apologize for my goofy little box graphic, but I wanted to show you how all the standards are related to each other. And hopefully this would help a little bit. So we start at the bottom with all of the different licensure and endorsement tracks that are available to somebody that says, I want to be a teacher. And I've only listed like one in each grade range just because I wanted to show you the gamut. So I think a lot of folks, talk about elementary, K-6. We have middle level, secondary, all level, and then I didn't really get into advanced licenses that require a pre-existing license. So there are standards for each of those separate content areas. And each content area, each program is reviewed by a review team compiled of practitioners in the field and faculty at the institutions. And there's usually 3 or 4 reviewers on each review team that look at the materials and the narrative that the program has given to say, this is how we meet the standards for elementary K-6 or English Language Arts 5.8. So that's one set of standards. Then we have the professional education standards, and they are worked in at that teacher preparation stage because the education unit, whether it's a department at the college or a school of education at a university, whatever they call themselves, so I call them all a unit, has to monitor as part of their accreditation how each license track under them is preparing each candidate. So we have another set of standards, the accreditation standards, and within the accreditation standards, what are called the INTASC standards, the Interstate Teacher Assessment and Support Consortium standards, which are basically verbatim the Kansas professional ed standards. So we have standards upon standards upon standards, but they're all good and we need them. So we have a couple stages there where different standards are being brought in and a different individual on campus could really speak to how candidates are being prepared. Then I think I will go ahead and have Kayla move us forward, and I'll get a little more into detail. And if you want to go back and look at the arrangement of all the standards to each other, we can do that. So in looking at kind of a survey of some of this material, each license track area, whether it's elementary or art or chemistry ed, is going to address how they train their teacher candidates to work with all children, to work with each individual child, to work with the caregivers and other stakeholders involved in education, and to work with their fellow teachers and specialists at the school. But it is all specific to their licensing track. So elementary preparation, chemistry ed preparation. Then the education unit that oversees elementary and chemistry and English language arts ed, in their accreditation process, they have to describe how each of those license areas prepares that teacher candidate to address those professional ed standards and those INTASC standards, which remember are basically the same thing. So they need the department, the education department documents how they prepare each teacher candidate to work with individual student needs, to create a supportive learning environment, positive social interaction, mutual respect, working with stakeholders, working with their fellow peers to say, I need to consult the school specialist on thus and such, and to build a supportive culture. And I'm going to ask you to move next slide. There we go. So we have that as the teacher candidates going through their preparation program. We've already got kind of two sets of standards and tiers of checking to make sure they're getting this. Remember, they're not a teacher at this point. They are a candidate. Once they have finished all that coursework, they also need to do, and I've got my slides, I realized maybe out of order for how I want to talk about them. They have the licensing test and the student teacher work sample. So I think I'm going to go forward one slide to the work sample, which every student teacher is required to complete. And some universities use a different one. Some have created their own. Some use the one that is available from Praxis. But in the work sample, which is typically done during student teaching, the student teacher has to observe and describe the classroom they're in. They have to select a subgroup that they're going to give more information on in this work sample that they put together. Those descriptions include emotional and attitudinal and motivational observations of the individual. They need to write sample plans for establishing a positive learning environment, including self-motivation of the child, positive relationships, positive classroom behavior, cooperation, engagement, and purposeful learning. They need to give sample lesson plans where they discuss specific classroom routines. And all of this gets observed by their cooperating teacher, by their university supervisor, and it gets graded. Classroom routines, procedures that they would do in a classroom, activities that they would do in a classroom that address the social emotional needs of those P12 students. And then they also have to give some sample summaries of communication interactions that they've had. I worked with this student about this thing, and these are the conversations we had about it, and you know, what came or didn't come from that conversation. So now I'll have Kayla go back one slide, because you have to finish the work sample before you can take the licensing tests. And these come from Praxis, from ETS. Every applicant for a teaching license needs to pass the Praxis test for that content area, whether it is chemistry for grades 6 through 12 or elementary K6 or music for pre-K 12. They have to pass that test. And then they also have to pass the Principles of Learning and Teaching test, which is specific to the grade levels that they're going to be working with. And on that test, they're tested again on, do they know how to promote a positive learning environment? Do they know how to look for bias and promote a safe environment? Do they know of what their peers do at the school and the role of stakeholders in education? Do they know the implications of major legislation, including mandated reporting? And they're also given scenarios in the PLT where they need to respond. If you're giving this situation, how would you react? What might this imply about the classroom that you need to change? So they need to go through both of those after they've finished preparation. And I had in the back of my head while I was looking through some of these, Kent's observation that he had had some difficulty getting folks to respond talking about the Jason Flat Act. And when I looked at the Principles of Learning and Teaching test, when I looked at the in-task standards, they don't call it by name, Kent. They talk about current legislation and laws. Let me find the right one where I've got it highlighted here. The teacher's responsibilities, applicable laws and reporting situations. So only my guess, but I was kind of worried about that the whole time that I was looking through standards. So I will have Kayla go forward one slide and then the next. All right. Because the program reviews are, kind of siloed, and then the education unit has that different set of standards above it, I wanted to get some summaries for you from some individual institutions of how they work this in. I don't have 24 different descriptions to give you because I didn't figure you wanted to spend that much time. So I just reached out to 2 private schools and 2 public schools. So I think you received those in your packets. And I am happy to talk through them if you want. I wanted to leave lots of time for you all to ask questions. So what would you like to know more about?
Okay, I'm sure we've got some questions from the group. You mentioned the Jason Flat Act, and I don't think there's any expectation that students would necessarily know the correct name in Kansas, but there is an expectation that they certainly know about suicide prevention.
Yeah.
And this specifically talks about bullying.
Mm-hmm.
And youth suicide prevention, for bullying and anti-bullying. So I guess the question is, how can we ensure that our colleges/schools of education are preparing students in that way? And I did read your summaries that you sent.
Okay.
And that's helpful. But again, there's only
Good.
4 of the 24.
Mm-hmm.
So, and I know they're all different. So I guess I'm sure there's probably some questions from the group, but my question is, when we go to the board, how do we assure the board that we have indeed asked that these teacher preparation programs address issues of bullying and various anti-bullying approaches and youth suicide prevention? Now, the thing that we'll have, it's the broader umbrella of school mental health, which is going to include other things. But right now, those two are probably the primary focus. So, how do we ensure the board that these are being addressed? I want to throw mandated reporting in there because that's a big issue too. So
Very much.
how are we assured that these are? And to me, as far as standards are concerned, they would be included in the professional ed standards. So have you looked at the professional ed standards? I mean, I know I looked at those before because we've had to approve them when I was on the board, and they're pretty broad and generic. So
I want to kind of leave lots of space for folks to talk. Otherwise, I just chat on. If you would go back to the first slide with the diagram, my little goofy boxes. They are addressed in the professional ed standards in Standard 9, which talks specifically about professional learning and ethical practice. And I'm terrible trying to read while talk at the same time. But it talks about the teacher advocating and modeling and teaching safe, ethical, legal use of information, and creating a safe environment. Every education college and university, they can't recommend for a license if they don't have accreditation. The professional ed standards and the INTASC standards, which are the same words, are in accreditation standard 1. If the college doesn't pass standard 1, they're not going to keep their accreditation. And they have to demonstrate in that they're preparing candidates in every licensing track that they offer. It is written broadly, as you noted, but it's done intentionally because we talked about the dyslexia task force a few months ago, and now we're looking at bullying, and the standards are written so that you can find both of those in the same standards. And then we have that principles of learning and teaching. They can't get a license. I'm trying to think if there are licensing routes where they could. But I think that is required to get a regular license. So when I look at it, I see it in those multiple places. It's not always identified as the word bullying. It might be a positive social environment.
Catherine, this is Myron.
Yes, sir.
Just a quick question. I guess I could just go over the wall and ask you, but I'll do it here. Just a quick question on this. So I think, I understand why things are kind of written broadly. I'm sure it's a kind of given 420 programs, it'd be a slippery slope to try and put every single detail into all that. And as the bullying task force noted, school systems still have the obligation once these candidates come to us to continue to educate and continue to provide those. For example, they may not know the name Jason Flatt. They may not know the name Aaron's Law, but we take it kind of the next level, provide more detailed information, legislative requirements, and that kind of thing. My question to you is, having not ever been involved with the accrediting process, do you feel comfortable that that accrediting process gets at the kind of things that we're talking about as they're going through, the kind of questions they're asked or things they respond to? Do you think it gets at the things we're talking about with regards to bullying prevention and awareness?
I really do think it does. I mean, I go on every single accreditation visit in the state, and they are a marathon. It is a team either completely in state or combined from this national higher ed accrediting group called the Council for the Accreditation of Educator Preparation, CAPE, combined of CAPE and state accrediting members. And they interview the faculty in each preparation area. They interview the leadership of the education unit, because you figure that education unit is probably going to handle things like the classroom management courses and field school placement and university supervisors during field experiences. They interview the teachers, the cooperating teachers at the district. They interview the principal and the superintendent at the district. And standard one, which is where the in-task standards are, and looking at them, looking at my notes page here, like the child students, I'm trying to specify the child student versus the college student. The P12 students' well-being and the teacher's responsibilities come up in accreditation standard 1, in-task standard 2, making sure the learners feel valued and respected and treated as individuals and value each other. In-task standard 3, which is managing the learning environment, fostering respectful communication. In-task standard 5, which is the learner's ability to develop diverse social and cultural perspectives. So being able to, the kids all get along. In-task standard 9 then looks at the teacher's professional responsibilities, and that's where we have the mandatory reporting. And then in-task standard 10 is the teacher being involved in the overall school efforts to build a supportive culture and ongoing connections with the community to enhance student well-being. And with the accreditation visits, it is basically 2 solid days of interviewing everyone who's involved in preparation at that college, interviewing the candidates to say, oh, do you talk about this and such in your class? You know, what have you been taught to do if the kids are fighting in the classroom? Talking to graduates who have gone out and are alumni now, and asking them, do you feel you were prepared? And everybody wants more preparation in classroom management, but if they felt they were ready to hit that ground running as a brand new licensed teacher. I do think it's a rigorous process.
Hey, Catherine, I'm gonna make a general comment, and then I think I'm gonna ask, because the council at some point in time needs to make a recommendation to the board.
Yep.
Do we feel this is covered, or do we feel that there needs to be some additional things?
Yeah.
So, and I think Myron, maybe you said this, but one of the things that we're talking about is pre-service teacher preparation. So knowing that this, for most of the students, this will be the first initial impact. Now, any of us can remember the first time we learned something, we didn't necessarily learn it. So sometimes when you come into a school district, there is, as Myron mentioned, there is ongoing training and teaching about bullying prevention, mandated reporting, suicide prevention, those things. But so that initial preparation, what's their initial thing? So I guess what I would ask for you to do for us, so then we can at a future meeting have a discussion, if you could dig into those standards and identify, okay, this is a standard, and I assume most of these are going to be in that professional ed field. This is the standard. Actually give us a standard and say this kinds of things would be covered here. and this kinds of things, and then give us another standard. So we then could have some information, because I know those standards are huge and cumbersome, but still, if we would know kind of where these things would be covered, then I think that could be helpful for us to then come up with a recommendation to take to the board. So is that doable for you?
That is very doable. I actually have that document. I just haven't quoted the standards in it where I highlight them. No, I take it back. I do have it where I've highlighted them. That's further down. But I know you all would want to see it in hand. I can show that to you if you want to look at it now, or I can plan to get it to you later if you want time to read it.
Yeah, why don't you get it to us? I know we'll have to come back at another meeting and spend more time on this and kind of discussing this. And you're certainly welcome to sit on that next meeting when we discuss that.
Wonderful.
It might be good to have you there. You can provide kind of a good resource for us.
I'd be happy to. Thank you.
I think that'd be helpful for the group to kind of see that and kind of correlate it to where it is, so we know what kind of recommendation we want to give to the board.
Okay.
Okay.
Kathy, this is Jean Clifford. I did have some concerns. One is that I think we really need to have some documentation that these things are taking place and some specifics, because when we have a lot of interest in this area, especially from the legislature, and I think we need to be able to point to specific places in our standards that in accrediting these institutions that show that they are doing this work. And I would like to see this on all 24 teacher institutions, and in a very specific, explicit way, that they are doing the bullying, suicide prevention, and mandated reporting. And I kind of do think that students completing a program ought to know what Jason Flat Act is by name, and some of these other things. I think we, assume that they are going to a district and will have continuing professional development, but they need to have a basic understanding to build upon. And I really do think these are basic. The bullying task force spent a lot of time on this and had some very specific recommendations. And while I see they're somewhat embedded in the institution's training programs, I'd really like to see more specificity in that we're meeting that, because if we don't do that and provide that for ourselves, we are going to get legislative assistance in that area. And we'd like to be able to maintain these things ourselves, if possible.
Nice way to put that, Jean, legislative assistance.
I could do that.
Okay, that'd be great. And I think tying it to accreditation would be important too. So I don't know, maybe you and Myron can kind of work on that. That'd be helpful.
All right.
And Catherine, Myron can give you some insight as far as where the legislature is coming from in terms of these issues. Both he and I have been over there several times. And what Jean was referring to is, if we don't get this done, they will do it for us, essentially.
That's putting it plain and simple there, Ken.
As best I can.
Okay, Catherine, thank you. We appreciate it, and we look forward to getting some additional information. If you got questions on what, if you want to shoot us the email early and have us look at some things, there's several of us that'd be happy to do that, and then we'll bring this back to the council.
Okay. So just to reiterate that I have it correct, you would like information regarding each individual college and education unit's accreditation information of how they are meeting accreditation standard 1.
Well, how they're meeting as far as these specific things with the bullying.
Specifically for bullying and suicide prevention.
Bullying, suicide prevention, and mandated reporting, I think, are kind of the big 3. Now, there may be others, but it fits under the umbrella of school mental health. So,
okay.
Okay,
Will do.
Thank you, Catherine. Really appreciate your time.
Sure thing. Thank you.
Thanks, Catherine.
Okay, Kent, we're going to go to you. You're going to give us a fast bridge update. And you said this would probably be a fast.
And you'll hold me to that, I'm sure. Christina referenced FastBridge, and essentially what FastBridge is, Kelly, you want to go ahead and advance it, is a formative assessment platform, and we also utilize the screener that they have developed called SABRES, okay? Let me use some of their language. So often in social emotional, Panorama has language, CTC has language, Castle has language, etc. And this is what how FastBridge describes themselves. It combines curriculum-based measures, they call CBMs, and computer adaptive tests. Okay, and as I mentioned, it's a formative and screener platform. Currently, I can't get into it too deeply because the contract with FastBridge is not complete. It's at the hands of the attorneys. But what we've asked is the opportunity to reduce the cost per student for FastBridge down to $4. Now, some of you are aware of this, particularly those that are in buildings and school buildings and counselors. But we did the same thing with Career Cruising, which is the platform we utilize for career exploration and pathway exploration. And that was very popular. It really took off, and we're hoping to do the same thing with FastBridge. Now, the reason why I took this screenshot is that you'll notice the topic is addressing implicit bias and disproportionality in SEB assessment. That shows you the depth that they're willing to go to in terms of their professional development. Okay. All right, Kelly, next. So this kind of gives you a lens from which FastBridge takes a look at social emotional learning. And they incorporate, of course, SEL, the behaviors they call social emotional behaviors. And then there are the tenets of PBIS, which shares a lot of commonality with our MTSS. Okay. SEB functioning is nurtured through a combined learning approach that addresses both social emotional skills and behavior. Okay, Kelly. Now, if you look in the lower left-hand corner, this describes what SABRES is. The Social, Academic, and Emotional Behavior Risk Screener, SABRES, identifies students grades K-12 who are at risk for academic, social, and/or emotional behaviors. SABRES can also universally screen by class, grade, or school to identify trends that may need class-wide attention. I'm about ready to be signed out. Oh, okay. All right, next, please. Well, go back, Kelly. The other two that are listed as far as SEB assessments, those are really just PK screeners. And direct behavior rating is in the process of being developed. Okay, next. All right, this gives you a really good idea of the strategy that FastBridge utilizes. All right, kind of their game plan, student skills, and then those things that they screen or develop a formative for, which includes reading and math. And then they provide customized reports and intervention guidance. All right, next, please. Now, we're always concerned about alignment, and FastBridge is aligned with Castle. And as such, by default, they're aligned with our social emotional character development standards. Next, please. Here's a copy of a SABRES report. And you can see it has a social scale, an academic scale, and an emotional scale. All right, next. And to dig a little bit deeper with the SABRES report, we're talking about self-awareness in Castle's approach, and this report shows you how they break that down. All righty. I think that was the last one. Any questions?
So Kent, if a contract is approved, you'll come back with more information.
Yes. In fact, I will have someone from FastBridge give you the real deal on, you know, all of the options that they have and how they break it down, et cetera.
And we
this
do
was-
currently have some districts that are using a safe.
Yeah, I was hoping Christina was going to stay on, but she had an appointment. Many MTSS schools or districts utilize FastBridge. And when the commissioner was going through, you know, what option to provide, I mean, the board goal is to measure SEL locally. And yet we weren't giving them any support other than what we do with technical assistance. And now we'll give them this option. But we looked at Panorama, FastBridge, et cetera. The problem with Panorama is that it didn't have a formative assessment for the assessed content areas like math and reading, whereas FastBridge does. And so, yes, MTSS does utilize FastBridge.
And Kathy, just so you know, when KISA did their survey of all the systems as part of the whole pause survey, we were asking what curriculums and assessment things people were using. By far, FastBridge was far and away the one that was getting the most utilized.
Yeah. Now, we need to understand too that even though we're trying to reduce the cost for FastBridge, Panorama is very expensive, but they're very involved and they're very detailed. So that's one reason why, you know, FastBridge is so widely utilized across the state.
And so this part will be, the cost of this will be offset by KSDE, but this is part of their using the Recovery Act funds to support.
Yes, ESSER dollars. Mm-hmm. Okay.
Do you know, I have a quick question.
Mm-hmm.
It's Holly Yeager. Hi. Do you know if that's for currently districts using them or new districts?
We're going to offer it to any district who wants to utilize it, just like we did career cruising.
The way
I mean, like for, you know, USD 259's been using it for a couple of years. So I just.
Right. So what we'll do is we'll offer to give them dollars so that they can reduce the cost down to $4 per student.
That's amazing. And it's
they have a way of addressing that. They described it in the board meeting, but I can't repeat it. But Randy and Brad they have that all figured out.
Awesome. Yeah, I was going to say, we definitely, I think another, you know, once you've screened, obviously we already mentioned it earlier. I know Kathy mentioned, you know, intervening, making sure that we have a plan in place. And I'd be happy to share some time with the council, maybe cool. What USD 259's doing with all of the Sabres data in addition to so we added into our, I think we call it warning, you know, almost like indicators. I think it's the warning indicators within a larger data system. And then we're developing currently, or me, I am developing currently for the district, a Sabres menu so that our principals and teachers, counselors, psychologists, social workers know where to go further with it. You know, what do we do now kind of thing, and what interventions might be a good idea to put in place. So again, it'll be a lot of it'll be 259 interventions we're already using and ideas, but I would love input on it too. So
great.
We'll have to make a note to have you share with us in the future. Great.
Kathy, there's a question in the chat about what ESSER funds are. I don't know, Bert, maybe could you maybe explain that to the group?
Oh, it's Jane. What a great use of ESSER funds.
Oh, I'm sorry. I thought the question was, what are the ESSER funds? Okay.
Yeah, well, to answer your question, Myron, it's the elementary and secondary emergency relief funds.
Okay.
That's on a future slide.
Okay. Well, Kent, thank you for the FastBridge update, and we'll look forward to more information, hopefully maybe at the October meeting. Okay, now we're going to go into a review of the teaching and learning, the navigating next. And if you remember from the, as we went into the pandemic, the department developed a lot of different information for us, and now they've developed a document. I believe this document's That says navigating next. So we're going to kind of take a look at this. And Kent, I think you're up on this one.
Yeah, and I'm having some issues with the feed. So if I lose it, you still have the slides, okay? Kelly, you want to advance the slide? All right, the way to find not only navigating next, but also navigating the change, which we presented on about a year and a half ago, go to ksde.org, okay, and look at the alphabetical list at the top and just go to N, and you'll be able to click on that and find both navigating the change and navigating next. Okay, next, please. All right, here's the timeline for this particular strategy. It was released in February of 2021 and was last updated March 9th, 2021. Next, please. John helped me put this together, and here are some of the thoughts that he had. The goal of Navigating Next is to support school systems providing concise, prioritized guidance for effectively and successfully completing the 2020-2021 school year, while simultaneously planning and preparing for the start of the 21-22 school year. So it was last school year heading into this next school year. Navigating Next will support districts in determining options for the use of federal elementary and secondary school emergency relief funds, ESSER, scheduled to be expended by September 2023. So they have 3 years. Navigating Next builds on previous guidance, Navigating the Change that I alluded to, Kansas Guide to Learning and School Safety Operations, a key resource for school systems as they implement instructional and operational practices. Okay, next, please. Here is the action plan. And you can see just moving left to right in the little columns or strands, physical and operational management, communication and engagement with families. Hi, Jane. Assessing student learning, academic delivery and support, social emotional learning, delivery and support. And of course, this is what the council would be most interested in. And then learning environment considerations. Okay, next, please. So moving forward, as we move forward into what we hope to be soon a post-pandemic era, focus must begin in earnest to address our students' social, emotional, and academic needs created by this extraordinary event. Schools must take what they've learned about their capacity for providing non-traditional classroom settings and instructional models and mobilize that into an innovative plan for recovery. Assessing and addressing the loss of student success skills won't happen overnight. We know that. There has been learning loss and there's been social emotional issues, but our efforts must start immediately. This document provides guidance for how to begin that work today. Okay, next please, Kelly. All right, so in order to achieve that or to implement what we were just talking about,
Did we just lose him?
I believe so.
Okay, do we have a backup plan here?
Jane, were you going to be presenting?
I can sure share my part of it, and then Kent could jump back on, but I'm happy to do that. If I can share my screen, Kelly, that would be wonderful. Let's see.
Are you able?
No, it won't let me yet.
Okay, hold on just 1 second.
Uh-huh.
Okay,
Sure.
try now. Try now.
All right, let's try again. The share button doesn't light up, so it doesn't give me access to share.
Well, can you talk about it, Jane?
Hey, wait a minute. Now I think I can.
Oh, there you go. Okay.
But let me see here. I don't want that one. That's KCTC. Okay, let me go back and get Kansas Teaching and Leading. All right, now can you see Teach and Leading?
Yes.
Okay, good. Oh, now Kent's here. Let's see. Kent, are you back with us? Kent, I thought he was. Okay.
Yep,
So,
I'm back.
oh, good. Okay. So
Sorry.
that's okay. Kelly, do you want me to back off and back out and let Kent go back to his slide?
You know what, Jane, you're fine because you're going to pick up the baton here in a moment anyway, okay? And you can just advance for me. As I was saying, what we did in cooperation with the Education Service Centers, in particular Greenbush, is develop a site called Kansas Teaching and Leading Project. And Jane has highlighted some of the resources that are available on that particular site. And Navigating Next is one of those. Okay. Did you guys already go through the 2 slides that I had on social emotional?
No, Kent. We immediately stopped, and now I'm on the live Kansas Teaching and Leading site.
Okay. I'll just real quickly tell you what we're on those slides. And essentially what it amounts to is under social emotional learning, we addressed diverse staff social emotional learning and well-being needs because we heard so much during the pandemic about the need to address adult self-care, okay? And there's several different posts on taking care of yourself. Also, there are posts on SEL delivery and support such as resiliency and those kind of things. Okay, Dr. Groff, the baton is yours. You can show us what you've added to the site.
Okay, yeah, will do. Thanks, Kent. Thanks for introducing the site. And as Kent mentioned, Navigating Next is a resource that is on this Teaching and Leading project website. And of course, excitedly to me, in Navigating Next are those 6 priorities that our board and our leadership have identified. And one of them being communications with families. And as we have known in this last year, families have been in our dining rooms, our living rooms, our kitchens more than ever before. Educators have been in our dining room, living room, kitchen more than ever before because, and the need for communicating with families is just been demonstrated. So I'm thrilled that it's one of the 6 priorities of Navigating Next. I'm thrilled with that. So then on each of these priorities, either school districts or sometimes state folks, sometimes service center folks, or like us, nonprofits, have been asked if we have any supports that we can give or put on this website to please do that. So under communication with families, I just clicked on it there so you can see. If you click on it, it will go on down and talk about if you're looking for a way to remain engaged or get engaged with families. They want this website to promote this best practices, ways to do that. So one of the things they had us do is the beginning. What can you do or consider first? And KPERC did so it takes you down to KPERC since we are the state resource center, and they put a little, see if it'll come up. There is a resource link and there's an introductory video that they requested that I do on where to begin with engaging families, where to begin. And of course, Kansas has endorsed family engagement standards. So this very brief 10-minute video is begin by looking at those standards. And then also looking at the KPERC website for resources and rubrics and things to do for where to begin. But for this group, one of the things that I think is a treasure in here is a treasure for Kansas. So in Kansas, we have social emotional learning being beginning to be measured and introduced to parents in kindergarten. And that is through something we call the ASQ, Ages and Stages Questionnaire. And there's an Ages and Stages Questionnaire 3, they call it, an Ages and Stages Questionnaire 2, which is on social emotional. So as I was thinking about this last week and thinking about it for Kansas and what it meant to you, is that in this work of our council and social emotional, it begins in kindergarten. We now have the Ages and Stages Questionnaire that is to be given and offered to families. They administer this questionnaire. So we added a video link, and there's a slide deck link that goes with it. And Rachel is a project coordinator of K-PERC, and she focuses in early childhood. And so she put together a video that talks about the ASQ 3 and the ASQ, the social emotional one too, on how one particular school district has an event, has the families come in, the kindergarten families come in on an evening, and they have the families in stations administer the ASQ. And this is a 60-70% Latino population, and so it's highly Spanish speaking. And so they have the families come together, and the parents administer the ASQ. The data comes in, then at another ASQ event, they share that data back with families. So in this video, Rachel introduces the ASQ, what it is and what happens with it. And then we particularly show and feature this school in Kansas City, Kansas, Emerson Elementary, and how parents are administering the, they call it a readiness snapshot. They give this readiness snapshot to parents and instruct them how to give it to their children this evening. And then we also share how they share that data back out with and to families at a later date. So this is would be great. I won't, share it now, but the important thing about this is, like I said, Kansas is doing this at the kindergarten level. And the beautiful thing is that the families are administering this snapshot. So they are providing the data. The data then goes into the educators then in different ways, but this particular school holds an event. When families come back in, they show the data, how the families, how the students look overall in their readiness for kindergarten and in their social emotional learning, how they look overall. And then they share individually how their children showed up in the different areas on the ASQ3 and the ASQ social emotional 2. So that is on the Teaching and Leading website. I'm trying to get back here to see if it will let me. It doesn't want to let me really move it back, but that is on the Teaching and Leading website. Then there is also one that we've added, and it is on a welcome back to school message. Again, it's a recorded video link on how one principal and the family engagement liaison, there's Rachel up there, she's did the recording, and how they are welcoming families back to school in English and in Spanish. So these are, as Kent said, on the Teaching and Leading website to give other schools an idea of, if you're doing a video, do it in English, do it in Spanish. And well, maybe I'll show you something. I'm not going to show you this whole thing.
Hello, thank you for joining. The session title is Welcome Back to School Messages.
But let me maybe take you to
that are spaced 6 feet apart. Student transitions will be limited throughout the day, but they will be traveling together to specials and lunch. As students travel throughout the hallway, we will keep them at least
That's what they were
in our blacktop area.
informing parents about every area, how we're going to
Front. Our buses will follow, and at our dismissal, instead of dismissal beginning at 3:50,
Example
here we are.
And this is
que están espaciados a 6 pies de distancia. Las transiciones de los estudiantes serán limitadas.
So these are just examples
en automóvil
of reaching families
to COVID and all of the safety measures. The first one that he addressed was related to
making sure that you're, things to go over, to communicate with families, to keep them in the loop. So anyway, you got a peek at one there. Okay. All right, that's something different. Communication. All right. So this is on the Teaching and Leading website under Navigating Next, under Communication with Families. So on this website, each of these areas are being built up and supported, but in particular, Kent, and I agree with him, really felt like the ASQ work, since one whole section of that snapshot is on social emotional learning, would be good to show you where it's at. And then I say hooray and cheer Kansas because of its social emotional touching way back beginning in kindergarten. Some preschools are using this also, I must say, but it's formalized here in kindergarten. And the beautiful, beautiful work with families that can be done here. You families need to know what social emotional learning is, and you're giving this assessment, and then you hear the data back. So I love this piece, and kudos to Kansas. So if you'd like to come watch these short videos, you know where they're at now. Navigating Next, Communicating with Families, and you might tell your kindergarten teachers or that they can learn more how to gather and share that ASQ data with families at the Teaching and Leading website.
Thank you, Jane. One of the questions that came up when we were talking about going over this material was who can add to the site. The site is coordinated by Greenbush, and Ryan Vaughn, who is with Greenbush and serves on this council, is unfortunately on vacation. But we have posed that question, unless Carrie, you found out something that I haven't yet. But there was a question as to, okay, can our members add stuff to the site? And that's something that we're trying to find out for you.
Kent, Jane, thank you very much. That Navigating Next, it's available to anybody. All you have to do is go on that KSDE website and go to the alphabetical listing up there and hit N, and there it is. So anybody has access to that. So appreciate you guys sharing that with us, and that good information there as far as the families are concerned. Okay, this last legislative session, our next agenda item is going to take a look at this. There was a bill passed, and if you ever see the thing HB and numbers behind it, it means a House bill that was passed. And Diane Gerstad, who works with our pilot project out in the schools, also has experience previously working with the legislature. So we asked her to share some information with us today as far as the HB 2208. So Diane, looks like that's been pulled up. And that's Diane's screen. You may be muted, Diane.
Yes, thank you.
There you go.
There's been a whole lot of concern over the broad topic of mental health crisis and suicide rates in Kansas, and the availability of services and the impact on law enforcement. So a year ago, the legislature convened a special committee on mental health modernization, which studied the state's behavioral health system, the availability of crisis services, the impact on jails, and substance abuse treatment. So the committee forwarded a strategic framework for modernization to the 2021 legislature that includes 26 recommendations. And okay, so to fast forward, this past June, after a lot of hearings and countless conversations, a ceremonial bill signing was held in the Rotunda. Governor Kelly congratulated lawmakers for their bipartisan work to pass 2208. This bill has been heralded as the most significant mental health legislation since the early 1990s when Mike Hayden was governor. The bill, as most legislative bills, it's not just one thing. It contains three distinct items, but each of them is really important to our state's infrastructure for the health and well-being of our citizens, regardless of their zip code. One portion addresses rural hospitals. The base bill addressed behavioral health licensure, and then the signature portion sets in motion improvements in behavioral health delivery system by CMHCs. And I think that the kind of common strand throughout this is money and how federal programs dictate how payment systems work across programs. So we'll start with the Rural Emergency Hospital Act. Our rural hospitals, as we all know, have had tremendous financial strain, Medicaid requirements, declining population base, aging population, staffing shortages. The state has seen a number of rural hospitals close. And one of the cost drivers for small hospitals is a requirement for them to maintain acute care beds. Senator Moran testified that many small hospitals have a census of less than one patient, yet the reimbursement requires the hospital to maintain the cost of those patient rooms, the overhead, equipment, and staff. Well, for a change, Congress helped out. Last year, they put together a new optional reimbursement system that allows rural hospitals with less than 50 beds the opportunity to change their licensure, remove the acute care beds, but in exchange, they have to maintain 24/7 emergency care, continue outpatient services, and then enter into transfer agreements with regional hospitals. The base bill again was introduced by BSRB. And this is in response to the shortage of behavioral health professionals. A year ago, the legislature passed a bill that lowered the hours required for social workers, postgraduate hours, supervision hours from 4,000 to 3,000 because we were basically higher than other states, and it was a barrier for our social workers. So BSRB requested the same reduction in hours for the other behavioral health professions that they license. And they also put in here that clinical supervision can be done over televideo. While the hearing was going on, the Association for Social Workers successfully argued for additional change in licensure because Kansas was the only state that required an additional 350 hours of direct client contact during the master's field internship, which had become a barrier. First of all, it increased costs for students, and on our border counties, we found that social workers were going to Oklahoma and Missouri for licensure. So this was a chart that they presented in committee, and you can see that we have fewer of our social workers getting their clinical licensure. So they're very hopeful that the kind of combination of changes in licensure will improve the number of clinicians that we have. And the portion of this bill that was heralded as the most significant reform measure since Governor Hayden directs KDADs and KDHE to submit a 1115 waiver to CMS that would move mental health centers who are currently reimbursed by Medicaid on a fee-for-service to a new model of reimbursement and outcomes called Certified Community Behavioral Health Centers, or the new acronym is CCBHC. So why have the community mental health centers really pushed for this? For one reason is that we are surrounded by states. All 4 surrounding states have either expanded Medicaid or received the Excellence in Mental Health grant. And so they are currently reimbursed at higher rates than Kansas. And we all know there's a fierce competition for scarce workers. That previous chart showed that, first of all, we have fewer clinicians to begin with. And because of the different reimbursement rates, we lack the funding for salaries. The conferees testified that behavioral health staff could cross into either Missouri or Oklahoma and receive $10,000, $15,000, up to $30,000 more in salary. So this bill allows for a phase-in of community mental health centers to CCHB over about 3 years. And it's more than just a reimbursement. It also changes the outcome measures for CMHCs, because as we all know, with federal dollars go federal strings. Kansas already has a model. In 2020, SAMHSA awarded lookalike grants for county mental health, has received one of those grants, and they testified how the changes in the outcome measures were changing how they were delivering programs and reviewing the services needed for their community, and really looking at their clients as a whole person. The model requires integrated care that emphasizes recovery, wellness, physical and behavioral health, outreach programs at people at risk of hospitalization or homelessness. There's an emphasis in this model to reach veterans and active duty families and providing services to them where they are instead of that 2-hour drive to Wichita. Ford County, in less than a year under this model, has significantly reduced their turnover rates for staff. They've been able to hire 68 new positions. They've expanded outreach to veterans. They've trained their staff how to understand the military culture and connected clients with primary health care providers, reduced the wait times, and scaled up services to people in the correctional system. Other critical needs that will be served by this new model include the substance abuse or tobacco cessation. There was testimony, especially in Northwest Kansas, where there's like no treatment facilities. So this model will embed that treatment. And also about avoiding jail. They had testimony from several sheriffs who spoke about the need to have behavioral health workers available on site to provide assistance at the time the person needs help, instead of just handing them a telephone number and hoping they call. So the model develops mobile crisis units to partner behavioral health with the police. Again, as I mentioned earlier, the funding method will change from current payment system on a fee for service to a prospective or actual cost, allowing the CCBHC to bundle services to help the entire person, physical, mental, and substance abuse. Finally, I mean, this is a very comprehensive bill. It'll help rural hospitals stay open, removes barriers for certification, and over the next 4 or 5 years, we'll move our community mental health centers into a new model of comprehensive care, supported by the funding needed for them to sustain it. Better outcomes for our communities and our population, and hopefully over time, increase the number of behavioral health professionals that actually work and stay in Kansas. KDADS and KDHE have until May 2022 to apply to CMS for approval of a waiver for our plan. And then also the heavy lift is to develop the methodology to determine prospective or actual cost. So why do this? Again, the surrounding states already have adopted this model and are frankly poaching our professionals. And secondly, Missouri has seen the benefits in just 3 years after implementation. They are reporting a 23% increase in access to care, a 19% increase in service to veterans, and 2 of the leading cost drivers for healthcare have both decreased. Emergency room visits are down 36% and a 20% decrease in hospitalization. So, Madam Chair, that is a quick review. I'm sure there's people on this call who know a lot more about the details than I do, but this is a review of that legislation.
Well, thank you, Diane. That was very helpful. That's a lot of things I didn't know. So do you want to make the PowerPoint available and Kelly can send it out to folks? If you just want to email it to her and then she can send it out to folks. I have a feeling people may be interested in the PowerPoint. Are there questions for Diane? I didn't see any in chat, but if you have questions, she can try to answer. Okay, thank you, Diane. Appreciate all that. Okay, folks, if you look at the agenda, the only thing we have left is membership updates. I don't think that's going to take too terribly long. I guess I'd like to ask the will of the group if they're willing to stay on for about 20 minutes, because I think we can probably go over that in about 20 minutes. And then if Bert is still on. Bert, are you on?
I believe he had to go to another meeting.
Okay, well, between myself and if Carrie's still on, maybe she can help me too. Is Carrie around?
I am.
Okay.
I just need to pull up my, yeah.
Are people okay with staying on for a little bit and then we'll just be done with the meeting instead of breaking and coming back after lunch? If I don't see any big objections, I guess I'll move forward. I saw a yes from Shelby. Okay, all right. Well, I think what we'll do is continue. We have feel a real need to kind of go through and do a membership update. And let me remind you, sent the bylaws back out to the group. So we have a formal process now as far as the membership and updating, excuse me, updating the membership. So so we do have a formal process, and Kelly has developed also an application process. So there is actually an application method. I seem to be a little croaky today. I was out doing yard work in this heat yesterday. Maybe I fried my vocal cords. But so we do have a membership process that we go through. A number of people on the list will need to, we need to do a little work as far as some vacancies. So I'm going to kind of take a look through here. I'll give you an example. I don't know that if John McKinney's on, but he's listed representing one group, although he does, but I think he also could represent another group. So what we'd like to do, and Kathy KO could recommend a couple of groups also. So if there's more than one organization that people can represent, we'd like to do that and have them represent both groups. So Carrie, do you, and one of the ones that I'd like to also address is we had local members of local boards of education. We had a small rural and a mid-size and a large. None of those right now are filled. So
Kathy, can I interrupt? We do have the small board member filled.
Oh yeah, that's Mark.
That's Mark Torkelson.
Right.
Yes.
So what we'd like to do is reach out to KASB and see if they have some recommendations of some people for us in those various areas, although, excuse me, if anybody else knows of a local board member who might be interested, contact Kelly and she can send out an application form. Carrie, I think I'm going to turn it over to you because I see having severe croakiness going on here.
Okay, so yeah, so as we were going through this and kind of analyzing it, we have some Kansas House minority members and Senate majority member replacements that are needed, and so that will be taken care of through Kathy working with our state board chair, and at that level. And then some of the other positions, I think it's, we're trying to be very inclusive and trying to be very, reach out to a lot of different people as we've built up the membership through the years. And then I think in that process of inclusiveness, what we're wanting to do now is make sure that we are, I want to say check all the boxes, but that we do have representativeness. And so one of the questions that's also come up is, and this is in terms of representing diversity, and how do we as a council, are we representative of the population we are supporting? And are we diverse enough? And then so if we're not, how do we get there? How do we know we are? Or we aren't, and what represents that. So that was a little bit of the kind of conversation we had on the leadership team as we were trying to make sure that we had that representativeness, but at the same time, recognizing that we want to stay within, we can't be it's a council, right? So we can't have, I think we're up to almost 40 or 50 members at some times. So how to also keep it narrowed down. So we recognize that the people that are part of this that are associated with or employed by KSDE, the department, we're ex officio. And so, but yeah, and we all in one shape or form really provide support to the council itself. So there were other, and we have instances where we have some people who still have terms to fill, but yet haven't been able to participate for various different reasons. And so wanting to get those filled. So Shanna and Kelly were working together to develop not just an application process per se, but from working from where we're at now, but also a way to keep track of this better for us, as well as the message that would go out and soliciting that membership. So does that cover the areas, Kathy, that we were?
Yeah, I think so. And if Kelly sent the list, so if you may not have that up, or I don't know, Kelly, can you pop that up?
Can I share my screen for just a second, Kayla? And Shanna and I did create, can you see the Google form? Okay. And foster care agency representative, is that what you see at the top?
Yes.
Okay. So this is the list of members that we need to fill currently. foster care agency representative, teacher, currently teaching elementary or secondary, Kansas Suicide Prevention Coalition, interlocal or co-op representative, association representing private nonprofit child welfare agencies, and so on. If one of you can also fill one of these areas, you can fill more than one area. And I did send out a quick little email last week and asked you to kind of let us know which areas you can fill. And we do have a couple of members that can fill multiple areas. Or if you know of someone that would be able to fill one of these areas, email me and I will send them the Google link to this form. And it's probably takes less than 5 minutes. And it just explains what the Mental Health Advisory Council is. And they'll fill it out and we'll end up with a spreadsheet with their information and everything. And then it's my understanding that the leadership committee will go through the applications and determine the best fits.
Thank you.
Are there any questions?
So
sorry, Kathy, this is Monica Meridian.
Yeah, Monica, go ahead.
Did you get my position? You know, I originally came on from House Minority. I think it was because I was chair of Health and Human Service. I mean, not chair. I was ranking minority on Health and Human Services. Did that position get replaced?
No, it did not. So if you have,
that one's, I would recommend the person that took my job on that, he's leaving the legislature as well. I would recommend that somebody ask Representative Tom Sawyer to appoint Representative Christina Hasgood. She is a Native American, very interested in behavioral health issues and currently represents the Lawrence area.
Christina Hasgood, Hasgood.
Yes.
Okay, all right, thank you.
And I'm sure Representative Sawyer would be happy to do that if somebody just contacted his office.
Okay,
if I can help in any way with that, I'd be happy to do that. So that would help a bit.
Thank you. As we look at these, if you noticed, Kelly was also asking you what board district you live in. One of the things we like to do is make sure we're represented throughout the state, because as we all know, different areas of the state have different needs. So if you know some folks that fit these categories, you know, when you have a committee that comes and, you know, the state capital's in Topeka, you have a tendency to have an overabundance of folks from the Topeka area, which I get. It's easier. It's also easy for travel and that kind of stuff, but we do want to represent from throughout the state. Not only are we wanting to represent our diversity in our state, but also our regions of our state. So if you know some folks from some areas and other parts of the state, that's helpful also. So any help that members, if you would, you could email Kelly, CC me if you want, or anybody else, and we'll be happy to help you out on this as we look for updating our membership list.
Yes, and when you email Kelly about this, will you also include Shanna Bigler, because she is our key point person program-wise for the RCAP, for the council.
And that's BIGLER. S.
So Kathy, one of the things we talked about was the teacher representative and some of the challenges that were that surround that.
Yeah, because it's tough to get a teacher to serve on these organizations because they have to get a substitute. And if you've been in the classroom, you know you don't like to prepare for a sub. You'd really rather be there. So that's always a little bit difficult, but we sure would love to have a teacher voice on this council. But if you can think of somebody, we'd appreciate that also.
I'm flipping through my notes here.
This is Jean Clifford. Could you send out that list in the application so electronically so we could maybe forward it to someone and see if they would be interested?
Yes, I can send that Google. It's a Google survey and I can send that out to the entire council.
That'd be great. Anybody else, any comments or questions about the membership list? Don't see anything else on chat, and nobody's coming up. So, okay, well, that wasn't too bad. About 15 minutes instead of 20. Okay, just final comments from myself as we're moving forward to the council. One of the things that's interesting that Shanna, and she would share this with us today if she was here, but she has been on a number of meetings about human trafficking. She thinks this issue is going to be coming up as we move forward. So you might kind of keep that on your radar screen. I have a feeling we'll be having some conversations on that as that becomes more of a topic throughout throughout the nation and throughout the state. With our I-35 corridor and our I-70 corridor, we are kind of at a crossroads for human trafficking, unfortunately. So there probably will be some conversation in the future. And it sounds like we're going to have some additional conversation on Fast Bridge as that comes up in the future also. And as we get back to school and the Delta variant is rearing its ugly head, so it may continue to be some issues this year. So I think the school mental health and the self-care for our adults. So don't forget to look at that website as far as self-care for our adults in our school buildings. So take a look at that, those resources that are out there. And remember, all you do is go to KSDE website and look at that alphabetical listing across the top and hit N, and you'll find navigating channel. That'll take you to the teaching and learning information. A lot of good resources there for folks. So that's probably all I have for the good of the order today. Anybody, anything else that they'd like to share? Okay, well, if that being the case, I am going to adjourn the meeting for today. And we are scheduled, our next meeting is scheduled to be October 14th. Right now we're scheduled for Zoom, which I'm sure will probably be the case as coronavirus has not left our domain at this point in time, unfortunately. So thanks, everybody. I hope you have a great start of the school year. We appreciate everybody's input today. And I am looking forward to getting back in person at some point in time so we can see everybody. So thank you all. Take care.
Thank you. Bye-bye.
Thank you.
Thank you.
Bye-bye.